Today we're going to talk about substance abuse treatment. And we're going to think about it from a variety of different perspectives that we talked about in the last video. But let's start by thinking about assessment. What kinds of questions might you use to assess drinking from that person? How do you feel when alcohol is not available? How does your behavior, how does your drinking change when you're under stress or when you're experiencing various emotions? How has your drinking changed? What feelings do you have about your drinking? How do other people react? How do you react to their opinions? How does your drinking affect other parts of your life? And we might also assess, that client's friends and relatives. So what kinds of feelings do you have about this person's drinking? How does he, she, view the drinking? How do you interact with others around the drinking? Have there ever been any consequences? How are other people reacting? How does he or she behave after a drunken episode? As we're thinking about treating substance abuse, we're going to be thinking about some of the risk factors, most of which aren't going to surprise you. They've been risk factors for some of the other things we've talked about this semester. A chaotic home environment, problems with parenting, attachment, problems in the classroom, failure in school, coping skills, etc. And also protective factors. So, positive family bonds, engaged parenting, clear expectations, clear consequences, doing well in school, doing well with positive institutions, and incorporating positive norms about drug use and alcohol. We're going to be thinking about different kinds of treatment goals, controlled use versus complete abstinence. Some suggestion that controlled use can work and can be effective. On the other hand, one of the advantages of complete abstinence is avoidance of triggers. Hard for an alcoholic to go to a bar without drinking. Little evidence in favor of inpatient treatment as opposed to outpatient care. A lot of evidence that community support groups such as Alcoholics Anonymous are helpful and are often seen as part of a good treatment regimen, most of which tends to be multidimensional. So it might include medication, particularly if there is an underlying Axis 1 disorder, underlying clinical disorder, often combined with some sort of support group like AA, with counseling, and with, helping people cope with some of the, getting back on track in terms of jobs, etc. A lot of the treatment models, particularly AA, have a very strong spiritual component. So the Serenity Prayer is one part or one aspect of the treatment model of AA, Alcoholics Anonymous. God grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. I'm not going to read you the 12 steps, but notice again, the very spiritual aspect, the attempt to recognize shortcomings, admit to problems, and move on. From a medical treatment point of view, there are both agonists that act like the substance, antagonists that interfere with the substance, and partial agonists, that will act like the substance at some levels and like an antagonist at other levels. And then there are also finally aversives like antabuse that cause someone to get sick when they're using the substance. Treatment seems to be very, very important. So relative to a no treatment group, and this is in a prison population, you see that very few people are drug-free following just being in prison. However, those people who complete the CREST program, who are probably a little bit different group, and receive aftercare are much more likely to be drug-free, so the orange and pink columns, and also arrest-free. And particularly, if we're thinking about arrest as a really important outcome, this is really a marked difference. Relapse rates tend to be pretty high, whether we're talking about alcohol, heroin, or nicotine. And so that's certainly something that we need to be thinking about. How can we prevent relapse? On the other hand, while relapse rates for drug addiction are high, they're also pretty high for diabetes, hypertension, and asthma. And in fact, hypertension and asthma are at least as high and maybe higher. Think about, as we're thinking about change, there are lots of things that make it difficult to change. And that's something, and to stay changed. And that's something that we need to be thinking about, whether we're working with substances or whether we're working in more a medical population, as I know a couple of you are planning on. As we're thinking about working with this population, think about stage of change. Prochaska's work has been really influential in the substance abuse field. Pre-contemplation, not even recognizing that there is a problem, may not even be aware of how these consequences are related to this behavior. Contemplation, aware but ambivalent about change. So in my therapy office, many people are more in a contemplation level. Action, the person has decided that there is a problem and are actively attempting to cut down. Maintenance, moderation or abstinence has been achieved relatively permanently, but at any point, for many of us, we have dieted and run into problems. Now, what we want to be thinking about, instead of failure and back at the same place as before, instead think, I ran into problems, and what can I learn about it? What can I learn so that I don't run into problems again? So rather than thinking I'm back to stage 1, relapse, what I want you to be thinking is, what can I learn from this mistake, which is a lapse? And I don't care what the mistake is. Part of life is making mistakes and hopefully learning from them. As we're thinking about relapse prevention, we choose a multidimensional model. So think about, we're going to identify the triggers and try and change those. So smokers, for example, will ask their friends not to smoke around them. We may challenge negative thoughts and influences, have to develop some things to do instead of going out drinking, strategies to cope with emotions, to deal with boredom, positive support. That's one of the difficulties of, for example, an inpatient program, or those of you who are working with prison populations, that there may be changes made here, but how can we generalize them out here? Challenging negative thoughts and influences, improving communication skills, learning how to relax or to manage stress in positive ways, to develop a positive self-image where it makes sense to invest in yourself. So what should you do now? We've talked in the last 2 videos about multidimensional treatment for substance abuse disorders. And I think that that's true across the entire course. So choose a problem in your own life and then consider all of the different factors contributing to controlling it. How could working with each of these impact this problem's severity or frequency? What could you do differently? And take care.